my primary area of teaching is in the assessment and intervention with CLD populations. And so our topic today is very relevant to that area. As we begin, I'd like to just affirm that I have no financial or non-financial relevant relationships to disclose. I am, of course, an employee of Abilene Christian University, and I do teach in this area. But other than that, I have no relevant relations to disclose. Our topic then today is dynamic assessment. And dynamic assessment is a methodology for assessing ability to change. When we talk about dynamic assessment in the context of speech and language assessment, we are really looking at an assessment strategy that can be used for a number of different purposes. But one of the main ones is assessing language learning ability in individuals for whom a standardized measure is unavailable, or perhaps because of cultural or language factors is not appropriate. These individuals can include ELLs or children with limited educational opportunity or experience. ASHA has noted, and as you can see on the citation here on the practice portal, that dynamic assessment can be useful in determining if speech and language patterns of an ELL or a client from a CLD population are the result of normal phenomenon or if they are the result of a communication disorder. So this is a highly recommended strategy. There is some good research evidence in support of dynamic assessment. There have been a number of studies since 2000, and most indicate that a well-designed dynamic assessment task can reliably identify children with language disorders versus children with language differences. Here are a couple of references of more recent studies that indicate that dynamic assessments have good sensitivity for identifying problems that are actually related to language disorders. And the references for these studies are at the end of the presentation in the reference section. Now, as we said, there's good research evidence for this practice, and ASHA recommends it as an alternative assessment strategy for the populations that we're discussing. However, it appears that this is a strategy that's seldom used. An earlier study from 2007 by Caesar and Kohler noted that SLPs, when working with these populations, still tend to rely more on formal standardized tests and scores rather than any alternative procedure for determining CLD or bilingual students' need for language therapy services. And in 2007, these authors noted that when participants were asked to list assessment tools that they used and strategies, dynamic assessment did not show up on the list of their sample. A follow-up study done in this area by myself and a student researcher showed that this pattern appears to be continuing. We looked in early 2016 at the assessment practices of both monolingual and bilingual SLPs and found that dynamic assessment was not in their preferred strategies for assessing this population. So why is that if we have good research evidence behind this? And if ASHA recommends it, why is it that this is not something that SLPs are feeling comfortable with using? And so as I've informally investigated this question, I've seen that there's some pretty significant uncertainty about how to do this mysterious practice of dynamic assessment. And then some very viable questions, very significant questions about, is this a good use of my assessment time? SLPs don't have a long period of time with each client to assess them, and so they want to make sure that the strategies that they use are a worthwhile investment. And so we're going to try to address both of these questions in the time that we have together today. I want to let you know that I very much welcome your questions, and I'm going to try to address those at the end of the presentation so that I can make sure we cover the material here. So we will be talking about a little of the history of dynamic assessment, types of dynamic assessments, and the steps involved in developing and then using dynamic assessment tasks. And we'll finish our time together by looking at two actual report samples from the dynamic assessment element with two clients reporting both positive outcomes and then outcomes indicating a concern with language disorder. So that's how we'll finish up our time, and then we'll take questions. So let's move on to some history about dynamic assessment. Dynamic assessment has got a very interesting history. The first professional to develop this concept and to employ it is Dr. Ruben Feuerstein, a cognitive psychologist who in just post-World War II Europe was charged with assessing the intellectual capabilities of children who were living in shelters and relocation camps across Europe after being liberated from concentration camps. As he was charged to assess these children, he quickly realized that the available standardized measures at the time were significantly over-identifying these children as having intellectual disabilities. And certainly this was a traumatized population with a significant lack of experience outside of their very constrained early years. And so he determined he was going to have to develop some alternative ways of looking at these children's capabilities to try to assess whether or not there was really an intellectual disability. And so he developed dynamic assessment as a strategy for looking at what he called modifiability, or rather these children's ability to learn. And the concept that he focused on was that children who show strong modifiability are unlikely to have intellectual disabilities, to very briefly state the central idea from his research. Dynamic assessment is an assessment method based on Vygotsky's social constructivism theory. And it's tied directly to the concept of the zone of proximal development, which I imagine many of you are familiar with. The idea of identifying what an individual is able to do and then seeing what they can do when assisted and how quickly they can move into independence in that task. So that ability to benefit from assistance and then move into independent functioning on a task, that's what we're talking about when we mention modifiability. There are two models of dynamic assessment that have been used in our field. And I want to briefly mention and define those and then really focus on one primary model, which is the second. But I want you to be aware that in the research literature you'll see discussion of two different models. The first is the graduated prompting model. And in this model, modifiability is tested by gradually increasing the level of support that a client needs to complete a task, and in our case perhaps a language task. If the client is able to complete the task with a lesser degree of assistance and quickly learn, then they are judged to have greater modifiability. The second model, and the one that we're going to spend a little more time on, is the Test-Teach-Retest model. And in this model, a skill is presented to the client. It's tested and pre-tested. Following the pre-test, the skill is taught in an intervention session, and the name for that intervention session is called the Mediated Learning Experience, MLE. So during the MLE, the client is instructed on the skill, and then after that, the skill is tested again in a parallel post-test. And if the client shows a higher level of competency on the new skill after minimal to moderate examiner effort, then we can say the client has shown good modifiability. This piece of examiner effort is a very important piece in the dynamic assessment model, and we'll spend some time talking about how we describe examiner effort in this particular strategy. So let's talk a little bit about the how-tos for creating the Test-Teach-Retest model of dynamic assessment. And we're going to focus on this model because it is, in my judgment, and in the judgment I think of a number of researchers, it's the most accessible model to professionals for creating a well-designed and replicable dynamic assessment that can be used across a variety of clients. So what I want to emphasize as we talk about the Test-Teach-Retest model is that it requires some advanced planning. It requires some work ahead of time. Dynamic assessment of any type is not something you can do spontaneously on the spur of the moment with a client. It does require some advanced prep. And so the test-teach-retest model is very much requires this effort before the assessment. Before we walk through the steps, I do think it's important to talk about who this type of assessment strategy is most effective for, who we're going to see the kinds of results that inform our assessment with which type of client. We are going to see the most consistent results with children who have at least basic interpersonal conversation skills in their L2, which in our case we're talking about English. So the children that we would consider intermediate language learners. If we're talking about beginning language learners, those who are just now being exposed to English and who are incipient bilinguals that we think will be bilingual, then the dynamic assessment may not be the right tool for them as conducted in English. And at that point we really need to focus for that new language learner on assessment in their first language. So dynamic assessment is very effective for those who have been exposed to English long enough to have some basic interpersonal communication skills, some BICS. So the steps in the dynamic assessment are simply these. First, you've got to select a task, and that's a very important first step. The task has to be teachable, has to be relevant to the referral concern, and we'll look at that a bit more in a second. And in our case, we want a language-based task for a speech and language assessment. Step 2, once we've chosen a task, we want to plan our measurement of skill in that area. Typically what you'll see is a pre-test and post-test format. And these pre-test and post-tests are going to need to be parallel so that you are able to see change in the skill, and they need to be brief. Step 3, you're going to need to design your intervention strategy. How are you going to mediate the client's knowledge and see change? What are you going to do to promote that change and see their degree of modifiability? And then step 4, you're going to need to have some methods for reflecting on how much effort did it take you to accomplish this change in the client. How much scaffolding did you have to provide in order for them to change? So these are the 4 steps, and we're going to look at each one in more detail now and talk about some of the decisions that the examiner needs to make in order to carry these 4 steps out effectively. Let's talk about task selection. How do you teach this relevant, how do you choose this relevant teachable task that forms the heart of your dynamic assessment? They can come from several sources. One source that I have found to be very helpful is the referral source. When a child is referred because they're having difficulty with pre-reading skills, early literacy skills, we can pick tasks that relate to that, such as a phonological awareness task. If a child is referred because the referral source sees them as having limited vocabulary, we might be able to devise a word recall or word learning task. If we are being asked to look at the child's difficulty with reading comprehension, we could perhaps devise a story detail task, a story recall task. So all of these would be teachable. They would be very specific skills related to the referral area. And of course, when you're working in a team, that's a very powerful way to work, to design a dynamic assessment that addresses their specific concerns. Another way to look at this is to look at grade or age level expectations. For example, in Texas we have the TEKS, the Texas Essential Knowledge and Skills, which is very similar to the Common Core in terms of a list of skills that children need to develop at certain grade levels in English language art classes. And so looking at those will also provide a source of tasks that might be appropriate to design a dynamic assessment around. Okay? Whatever task you select, you're going to want to take into account the following. First of all, how teachable is the task? Sometimes we get referrals because a child has difficulty with grammar. Okay, well, a task such as the child will be taught to produce grammatical sentences is obviously a very huge task, not something that can be taught in a brief amount of time. So that wouldn't be considered a teachable task for this particular dynamic assessment methodology. Now, another factor that you'll want to consider is the amount of time that you think that it's going to require for an MLE for whichever task that you have selected. In the original dynamic assessment tasks that were presented in the early 2000s, very often these were planned to stretch over a couple of weeks, a week or so, where you give a pre-test and then do an intervention over a week or 2 weeks and then do a post-test. What we saw after that was that SLPs did not feel that that was time effective. And so you're wanting to find a task that you can teach during an evaluation session, during a 30-minute to 1 hour time period. Okay? And you're going to see some examples of some teachable, measurable, brief tasks that you could utilize for such a session. I recommend that whatever task you choose, you make it one that involves high frequency vocabulary and avoids a focus on grammar. Why am I making these recommendations? Well, we want to ask the learner to use words that they probably already heard before productively to accomplish a new task. We can control for an appropriate level of difficulty for our intermediate ELLs by avoiding vocabulary that is out of reach, that is low frequency vocabulary. I also recommend that you avoid grammar-based tasks. Why is that? Because these children are likely dialect users, and grammatical variations in English will probably be part of that dialect. Trying to teach a grammatical skill that goes against dialect is an uphill task and may result in discouragement for the child during the session. And then failure to learn that task would not be very informative for you as the examiner, because you would have to question whether the failure to change is due to the impact of dialect or whether the child is really having difficulty with modifiability. So let me summarize task selection by saying this. The question you're trying to answer is not, how good is this child's English? But rather, what can he or she do with the English that they have? If you see a child making good use of limited English skills to learn a new task in a dynamic assessment context, then that child is unlikely to have a language disorder. Language difference, yes, but language disorder is much less likely if they're able to use their English effectively in this manner. So let's talk about the MLE. The pre and post test creation. Again, focus on being brief. We don't need a half-hour pre-test and a half-hour post-test to test one skill. I found that it works very well to have a pre-test of 10 to 15 items and then a parallel post-test. Depending on the task that you select, you may be able to base your pre and post-tests on worksheets that you have available, or you might be able to model your pre and post test after some standardized test protocols. But remember that you need these tests to be brief, and you need them to measure the same thing. You need them to be at the same level of difficulty. So you'll need to try out your pre and post tests before you actually use them to see if you can perceive that they are at a similar level of difficulty and measuring the same type of skill. If the tests are not of equal difficulty, then you won't know if your child has really demonstrated change. And there are some statistical ways of looking at difficulty. Those of you who are good with spreadsheets, with Excel, could look at correlations between pre and post-test scores to see how closely matched they are. Let's talk about now the MLE. The MLE typically can be conducted in a 20 to 30-minute activity session, and it's designed to teach the skill that you are measuring. As you think about how to teach this skill, you'll want to employ techniques that are routinely recommended for the instruction of ELLs. Here are a list of such strategies coming from the ESL literature. And I would add that pairing up with an ESL teacher, if you're a school-based practitioner, would be an effective way of getting suggestions for strategies to use in your MLE. But if not, if you're practicing in a different site, there is literature available that talks about what kinds of things do we typically recommend for ESL learners so that they can function in an English classroom. As you'll see here, some of these are very self-explanatory. Repetition. What happens if you simply repeat the question? Rephrasing. What happens if you rephrase the question that you are trying to have the child understand? Can you get them to understand it with a simple rephrasing? Slower pacing. When you slow down and give the child more time to process the English language, does that change the way that they are able to interact with the content? Gesture use is another thing that's recommended for ESL learners. Adding in gestures to help increase comprehension. And then the use of visuals. These are all strategies that are recommended for typical ESL learners. And some of you might be thinking there are also strategies that we use in therapy with children with language disorders. And that would be correct. So part of your challenge then, as you look at the child's performance during the MLE, is to see if you can notice that your effort in instructing them is less than what it would be with a child with a language disorder, because that's what you're really looking for. Now, again, I've noted that the MLE can be 20 to 30 minutes long. The entire process, in my experience and in some research that I've done, a dynamic assessment process can be completed in 40 to 45 minutes. That should be long enough to pre-test quickly, to conduct a brief teaching session, and do a post-test. An hour, in my judgment, would be more than sufficient time to do this process. If the child is not having success during your teaching session and you are employing these various strategies, which are evidence-based practices for ESL learners, then that is informing you about what's going on with this child. That is letting you know that there may be some learning difficulties that go beyond the ESL status, the ELL status. One important point that needs to happen during the MLE is that you need to talk to the child about how they can generalize this new skill that they're learning to another context, which will be in the post-test in just a moment. You want the child to think about how they could do this independently, how they could remember the strategy that you're teaching them. What was hard about it? What was easy about it? All of these discussion points help the child then attack the items on the post-test independently with the new skill that they've learned if they've been able to modify their understanding of the skill. Let's talk about modifiability. One of the very interesting things about conducting a dynamic assessment is the idea of an aha moment. With these students, if they have good learning ability, if they have good modifiability, you will see what I call the light bulb moment, where they go, oh, I get it. I understand. And then you quickly see them during the MLE beginning to respond to the probes that you're using in your teaching session, to be able to answer questions and to move forward in the task with much more ease. That is very significant for this process. The other point that you want to take into account when you're measuring modifiability is to consider the amount of change noted from pre-test to post-test. Is there an increase in the score, and how much? You'll want to be able to quantify that, and that's very important when you are reporting your dynamic assessment results to the stakeholders who care about this child's assessment. Dynamic assessment is not a typical standardized test, as we have noted. And so how do you report your results to other interested readers, other professionals, parents, in a way that describes what the child has been able to do and what you have learned from that? Well, you're going to need to be able to summarize it in terms of modifiability. And so one way to do that is to talk about how much change was noted and whether or not the child showed ease in acquiring this new information. My experience has been with well-designed, age-appropriate tasks that use accessible vocabulary. Usually there is this moment when you're working with the child where you can clearly see that comprehension has increased, the aha moment, the light bulb moment. And then you will see that all of a sudden they're being able to respond to you with more ease because, oh, okay, I understand now. And so these are factors that you'll want to be able to discuss. One of the questions that has arisen in the dynamic assessment literature and in practitioners as they try to employ this strategy is talking about change. When you see just a little bit of change and you have put in maximum effort, you have used all of the ESL strategies in order to help this child learn, that does not indicate good modifiability. The small amount of change. Now, of course, one of the questions that we have is, what is a small amount of change? And I would say, if the child is just able to answer maybe 1 or 2 questions more than they could do at the pretest after significant effort on behalf of the examiner, or perhaps no questions, then you're not seeing a significant change. If the child is getting it, then you'll see that they'll answer a significant number of questions more than what they were able to do on the pretest. And there will be a clear indicator that they're understanding better what it is you were asking them to do. So when we see good modifiability, we see a significant amount of change, several questions more answered, and the examiner does not have to pull out all of the stops to get there. So there is a continuum here of how much effort did I as the examiner have to put into this, and how much change the child attain. And this is really where the art as well as the science of dynamic assessment comes in, is in the reflection and consideration you give to the degree of examiner effort compared to the amount of change that the child is able to attain. We'll talk just a little bit more about that in a moment. Here are some things that you can actually measure to think about your effort in the dynamic assessment, as well as your subjective impressions of your effort versus the child's change. One thing you can look at is the time needed to achieve the task. I would suggest, as you're thinking about looking at designing a dynamic assessment, is to try it out with some children and get a sense for how long this task should take. And we'll discuss that when we look at the 2 case studies that we're going to look at as we come to the end of this section of the presentation in terms of how long should the task take. But recording the amount of time I think is very helpful. Another thing that you can talk about that you can reflect on, that you can also talk about in your write-up, is the types and number of cues needed for task achievement. In a well-designed dynamic assessment, I found that, again, if I'm using accessible vocabulary with the child, then I can achieve a lot with slower pacing and some repetition. And they're not needing me, again, to pull out all the stops and pantomime correct responding or give them direct models to imitate. If the child is continuously needing a high degree of cues in order to achieve the task, then this is a problem. And then certainly you'll want to give subjective impressions of your effort involved in comparison to the child's ability to change. If you note that you had to continuously prompt and cue the child, and that there was never a moment at which the child seemed to demonstrate clear understanding of the task, and that the child was not able to come to a point where they could respond independently to questions that you're asking during the MLE, then your effort is going to have to be described as maximum. And that's your subjective impression of your effort. So that's another thing that you can talk about. Let's move on then to talking about how we're going to interpret and report the outcomes. We've already mentioned some qualitative and quantitative observations that you can report. Your quantitative data can include time required to learn the task, number of correct answers on pre and post test, or percentage of correct answers, and percentage of change observed. Again, your qualitative data should include a discussion of the perceived level of examiner effort with some explanation. You're going to want to interpret those observations by talking about whether or not the child had that aha moment where he appeared clearly aware that he had learned a new skill or concept. And then something that's very important is that when the prompts were faded during the MLE, I'm going to change that word here to MLE, when you started to fade prompts and support, did you see the child being able to transfer the new skill to items that you had not trained yet? And this is part of the design of the MLE, where you're giving them the task items to work with, and you're interacting with the child to help them understand the task by explaining, prompting, cueing. And then if they have that moment where they demonstrate comprehension in their aha moment, are you able then to fade that support and the child demonstrate transfer of skills and then do better on the post-test? So these are all things that you can discuss in your write-up of the outcomes of this assessment. Let's pull the pieces together now. Here is a dynamic assessment of a child with good language modifiability. In other words, their diagnosis of language disorder is unlikely because of the way the child responded to the MLE. And so this is part of an actual write-up from a report. Let me give you a little background. This child is a Spanish-speaking child, an ELL, in 3rd grade, referred because of academic problems. And essentially the referral was that Antonia was not learning to use English as well as the teacher felt that she should based on her amount of time in the English language classroom. So we didn't have specific academic concerns. So the task that I chose to use with Antonia was just a verbal problem